Coming up today, meet a young woman facing the challenge of a lifetime with grace, dignity, and determination to not let it hold her back forever. Good morning. It is Tuesday, November 1st. I'm Jessica Lovell, and we are live here inside the Dolph C. Simons Jr. Family Broadcast Studio. Nearly 200,000 people in Missouri and Kansas live with epilepsy. Nationwide, 3.4 million people and their families are affected by this neurological disorder. So what causes it, and what are the new ways to treat it? Get your questions sent in to us through the links on your screen, or you can drop them in the chat thread below. We'll get to those in just a bit. Unfortunately, though, epilepsy remains a mystery for many with this diagnosis. The Epilepsy Foundation says there could be a genetic component, reporting some common causes that are brain trauma or head injury, brain injury at birth, or infections of the brain from meningitis or the measles. It's estimated that 1 in 10 people will experience a seizure during their lifetime. Some triggers include missed or late medications, stress, anxiety, lack of sleep, or flashing lights like strobe lights or even video games. But in many cases, there is no identifiable trigger. So imagine living your entire life with 2 debilitating disorders. A study published in the National Library of Medicine found many children with cerebral palsy have 1 or more additional conditions or diseases. It found 4 in 10 children, almost half, with cerebral palsy also have epilepsy. Sarah Bateman is one of those people.
Mila, can they stand up here? So far, today's a good day.
Donna Bateman has been living with epilepsy for 31 years. It consumes her day-to-day life.
Is that on TV?
But this debilitating neurological disorder isn't hers.
High five.
It belongs to her daughter, Sarah.
Is Roxy having fun too?
It's a path they've traveled every day together.
The journey that Sarah and I have had is not just how do you take care of laundry, take care of your house. You know, you just think your life's going to be that way and your child's always going to be happy and healthy. And when the day comes and that's not true, I wasn't prepared for it.
I would like to be able to live a normal life, to be able to not have to worry about seizing every day.
Donna remembers when Sarah seized for the first time at just 9 months.
I heard a sound and I thought, oh my God, she's throwing up, and flipped her up. By the time I could sit up and I could turn the light on, like, she didn't throw up. I thought, well, that's weird. What is that?
The next few years were countless trips to Children's Mercy Hospital, emergency room visits, endless testing, lab work, and checkups. By the time Sarah was 4, her seizures seemed to be under control, and for many years she was able to enjoy being a kid and a big sister. But by the 8th grade, Sarah's seizures were back, and much worse.
You really want to know what a bad day is? When your daughter is probably 16, she had a grand mal seizure in the restroom, and her head was stuck between the toilet and the sink, and her feet are curled around so the door can't open.
Medications did little to help, so they turned to neurologist and epilepsy specialist Dr. Carol Ulloa with the University of Kansas Health System. Under her care, Ulloa recommended a deep brain stimulator. The device was surgically implanted into Sarah's brain to help decrease her seizures.
The hope is that she will have fewer and fewer seizures. The wish is that she won't have any.
And Sarah's wish?
Is that so pretty? It would be nice to be able to meet someone that would be able to deal with my seizures, and I want my family not to have to worry about me all the time.
And we are joined now by Sarah Bateman and her mother, Donna, along with me here in studios, urologist, her doctor, Sarah's doctor, Dr. Carol Ulloa. Ladies, so good to see you today. How are you?
We're good. Good.
Good. It is so good to see you, and I think I speak for Dr. Ulloa. We adore these women. Getting to know them has been a pleasure, right?
Absolutely.
It really has. So, Donna, I want to start with you. Kind of just sum up what has been the #1 challenge helping Sarah navigate this tough diagnosis.
I think the trickiest thing is you never know when it's going to happen, anywhere, anytime, any place. And so how do you be prepared for that? You know, as a caregiver, how do you make sure you have what you need to take care of them in that time, in that place? And how do you prepare her? Because there's not much she can do to help herself. So it's really tricky. It's really tricky.
You had mentioned, you know, just going out, you have to kind of assess where you're going, how long you're going to be there, what the environment is, so that you can always be prepared. Sarah, what has been the most challenging part of the day-to-day for you?
Challenging part for the day-to-day for me, trying to deal with all the consequences that the seizures cause, such as memory loss, as well as trying to figure out if it's okay to continue to do certain things, or should I stay at home because a seizure might be coming on.
Yeah, you just never know. Again, it's that day-to-day. Dr. Ulloa, this isn't the first time, though, that I've done a story with a patient or their family that said meeting you was a game changer for them. Tell me about the first time you met Donna and Sarah, because they come as a duo. You get them both because they're both traveling this together.
Yes. Yes, it's definitely a family journey. The patient, you know, experiences it in one way. The family experiences it in a different way. It was actually many years ago. I think it was soon after I started working here. And ultimately, I could tell that they had gone through a lot throughout Sarah's life, and that they were seeking answers and just someone to listen to them and a way to get better. And so we kind of embarked on a journey to try to reach those goals.
Well, and I think that Donna had mentioned that you'd been from kind of treatment to treatment and different doctors, and then you found Dr. Ulloa, right? You remember that, huh, Donna?
Oh, like we say, the sun rises and sets around Dr. Ulloa. She's the best kind of doctor because she listens. She really listens. I remember the first time we saw you, Dr. Ulloa, we came in, we were waiting, and you came in and you watched Sarah and you listened to her and every word and asked questions, and you saw her. You saw her and you listened to her. And that is, you know, the most important thing ever. It really is. It's the beginning of a path to wellness. Because if you can listen and you can hear and you can see who the person is, we have options, you know? Yeah.
I love that. I think you're right. You said it. You nailed it, Donna, because that treatment starts in that first moment when you, like you said, she saw her. This isn't about the treatment path or the medication or the deep brain stimulation that we're going to talk about. It's really just being there for them and in that moment with them. So, Dr. Ulloa, tell us about DBS, deep brain stimulation, and we'll just talk about what it is, how long it's been around. We're going to show some video of it happening actually in the OR.
Sure.
Walk us through it.
So deep brain stimulation is a type of device for epilepsy. It's one of 3 FDA-approved devices for epilepsy. And basically, there's a battery that goes under the chest wall, and it connects through a wire to 2 electrodes in the brain, one on the right, one on the left. And those electrodes go to the thalamus, which is kind of at the core of the brain. That's why it's called deep brain stimulation. And the electrodes send electrical impulses to the thalamus on and off throughout the day. The thalamus is known to be a big part in how seizures form and grow. And so those impulses can sort of interrupt those connections and over time help decrease the number of seizures a person has.
And this has been pretty successful for the people who've been identified for this to be a good option for, correct?
Correct.
So that's what's going on inside the brain, but let's show some photos of how you are monitoring this on the outside and what you're seeing here.
Yeah, so this, we kind of have this computer device that's how we adjust the settings of the stimulation. So you have to start off at low settings and gradually go up, which is in part why it takes time, for it to work. And then we're able to, what we say, interrogate the device, assess the battery life, how well it's functioning. And so Sarah does have to come into the office relatively frequently, about every 2 months.
Is it here? Do they have that on their cell phone? Is that something they can monitor, or is that something you have to adjust?
Both. I have to adjust it, but there are certain things that they can actually check on their own, like the battery life, if it's indeed turned on. And you can even adjust it. Let's say we turned up the stimulation and for some reason the person went home and found that it was too high, we can actually allow them to lower it.
So Donna and Sarah, when you heard that you would make that Sarah would make a good candidate for DBS, what were your thoughts? You must have had a few questions.
Well, a little concerned. Brain surgery is intimidating, but mostly just joy to think that we could finally have something that would really work, that would really give Sarah the life that she deserves, the life every mother wants her kid to have. And so we were just, it's the hope. It's the hope of the future that someday she can drive, that she can do what she wants, and it's great. That's my thought.
Dr. Ujo, why was Sarah such a good candidate that maybe somebody else with epilepsy wouldn't make?
So I think I would back up a little bit and say that ideally, from a surgical perspective, we would be able to identify a focus, a single focus where the seizures come from, and identify if it is safe and remove it or laser it. And that's the type of surgery that gives people the highest chance of actually being able to completely stop their seizures, gives them the possibility of a cure. But not everybody ends up being a candidate. And so for Sarah, her seizures came from multiple areas in both the left frontal lobe and the right frontal lobe. And so that's where deep brain stimulation actually becomes a great option, because it has the ability to treat all those areas.
So what was it like in recovery? Sarah, what do you remember about coming out and kind of going on that next path to a better life? What do you remember being in the hospital? Because you look like you got a big smile on your face.
Well, I was definitely happy to try this. I was really hoping that this will change my life, because I'm tired of always having the side effects.
And I know a big part of it, the baby that we see in these photos is your niece, and something that's been so important to you is to be able to hold your niece safely. And Donna, that's just another one of those day-to-day life things that we all take for granted, right?
It is. And it's, you have to always be careful. An adult holding a child has to have full control. And if you don't have full control of your arms and your body, it's not a good idea for you to be holding a child. So there are times Sarah can hold Mila, and there's times she can't. So,
Dr. Ujo, we had mentioned in our story off the top of the program that Sarah has cerebral palsy. What effect might that have? We also gave a statistic 4 out of 10, or nearly half of children born with cerebral palsy may develop something else, some other type of disorder. So walk us through that and what we know.
Yes, so essentially the cerebral palsy and the epilepsy are quite intertwined. Most likely the same injury that caused the cerebral palsy is also a big part of why Sarah has epilepsy. So when we look at Sarah's MRI, we see that on the left side of her brain, there was an injury that occurred, and it affected a lot of the frontal lobe, for example. And that's why she has weakness on the right side of her body, and also why there's a part of the brain that can give rise to seizures.
Okay, so that's something that happened in the womb? You said an injury.
So it's an injury that happened very, very early on in life, and likely in the womb.
So when should Sarah start to see results from the treatment? I think Donna said that they have, she has noticed some changes, but this could, take up to a year to really see the full effect?
I usually tell people it takes a year to really assess what the treatment is doing. And in part, that's because we have to, over time, increase the stimulation, but also give it time to work. And so if you look at the studies, on average, at 1 year, there was about a 45% reduction in seizures. And year to year, that number kind of goes up. And so by 6 years, it's about a 70% reduction in seizures.
All right, everybody hang tight, because I want to check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. He's got our COVID count this morning and a couple headlines for us.
Yeah.
Good morning to you. How are you?
Good.
Good.
Yeah, 20 active infections with 5 in the ICU, 1 on the ventilator, still 26 in the recovery period. So we're unfortunately just hanging around those same numbers, really high teens, low 20s. That's kind of where we're at right now. Hopefully we'll continue to stay there or go down, but again, we know that there's those possible other viral surges that are going on as well.
Okay, scientists are working on a nasal spray to block coronavirus infections, but formulating the spray is somewhat of a challenge. So could a nose spray a day keep COVID away?
Yeah, I mean, I think we certainly need to investigate that. Again, we know no vaccine protects really against infection. I think that's important to understand. This is one thing with a compound that could help do that, you know, instilling that into your nose or your upper respiratory tract once or twice or maybe 3 times a day, depending on what the exact formulation is. But I think it is one more step to preventive measures that we can take, especially if you're traveling or you know you're going to be traveling or you're going to visit people that are maybe higher risk. One, you know, things that you can do to help protect yourself against, you know, being ill when you're traveling or bringing that to your loved ones if you're traveling there. So I think it's overall a good thing, and especially if you are higher risk or if you don't respond to a vaccine, this is one more thing we can use to help keep you safe from this disease.
Okay, Uganda's health minister announced officials will evaluate 3 Ebola vaccine candidates in the coming weeks and report some healthcare workers are already testing some new treatment options. What do you know about that?
Yeah, I think that's pretty good. Again, so right now in Uganda, there is an Ebola outbreak. It is caused by Ebola Sudan, which is a separate strain, now not a variant, but a separate strain from the other typical Ebola outbreaks that we've heard, which were caused by Ebola Zaire. For Ebola Zaire, we do have a couple of therapies as well as a vaccine that is used during those outbreaks, but for Ebola Sudan, there are no such therapies. So this is very good news. We know that early on there were initial trials against Ebola Sudan for these vaccines. Some of those were put away. We know Merck had a large batch of vaccine that they were trialing, but then kind of shuttered that a little bit as the Ebola outbreaks subsided. But this is very good news, especially for those people in Uganda who are suffering from this. I think we do expect these vaccines to work. We have a little bit more information about the Merck one, so we really do expect that to be beneficial. But I think it's good if we can come up with, again, more therapeutics, more preventive measures for any of these infectious diseases. It's going to be beneficial.
Absolutely. Doc Hawk, thanks so much. Any reporters on the line today? Well, let's get to our community. Donna, Patty has a question. Patty has somewhat of a similar story as yours, and she's just curious, what's your best advice to caregivers that might be going down the same road you are?
I think the most important thing is to find a doctor that you can communicate with and that you feel really, really listens to you and sees the person you love that's dealing with this, because everything starts with that. When you have a doctor you can trust, then you can move, you can go forward, and you know they listen and they really care about what's happening to you and your person. So that's my best thing, is to do that.
And I think you also mentioned when you and I were visiting too about just finding good support outside of the hospital, something that kind of, because you got to take care of you, Donna, right?
Yeah, that's the hope, right?
Absolutely.
So I'm lucky. I have good support. I have a lot of sisters and my mom and my mother-in-law. So I have a lot of good women in my life that help us to manage, because it is hard. It is hard, and it takes more than just one person. And it's good. It's good to have family. It's good to have, social outlets. It's good to have a little bit of creativity, something you can create here and there in your life, and and faith.
Yeah. Absolutely. Great advice. Jim wants to know, Dr. Ulloa, does this get rid of the need for any oral medication?
Oh, that's a good question. I think the easy answer is no. Earlier I said how the removal type of surgery does open up a door to sort of a cure or stopping the seizures. And but the devices, really the goal is to lessen the number of seizures a person has. There are some people that can stop having seizures with the devices, but that's really not the expectation. And so because of that, it's something that works together with the medicine. But I will say that if the stimulation, the deep brain stimulation, does result in a really significant lowering of seizures, it does open the door to being able to then lower the amount of medicine a person has, which then can overall improve the quality of life with less side effects.
Yeah, slowly weaning off of medication, always a good goal, right? So Yen Liang has a question. Could DBS be used for patients with Parkinson's disease?
Oh, absolutely. And it's been around for Parkinson's disease for a long time, long before epilepsy. The thalamus has different, what we call nuclei. So the target within the thalamus is different for Parkinson's than for epilepsy. But absolutely, in my neurology colleagues that treat Parkinson's disease do that procedure quite often, along with the neurosurgery team, of course.
So Ryan has a question. You mentioned who's a good candidate. Go back over that, because how would someone at home who might have epilepsy or have a loved one with epilepsy know to ask about DBS?
Yes. Well, I think it really boils down to, are you still having seizures despite trying 2 seizure medicines? So you were given one medicine, you still have seizures, you tried a second medicine, you still have seizures. At that point, you're considered to have drug-resistant epilepsy, and that is the time you should be seen at a comprehensive epilepsy center. And so that's a place like ours where we have people who focus just on treating epilepsy. And it's a road, you have several tests to really understand what your options are, and a lot of discussions along the way. So I think that's the key. Are you still having seizures? And thereby you really should have an evaluation at a comprehensive epilepsy center.
If we could show some of those photos of Sarah in the hospital after her surgery, because as Donna had mentioned, that's always a concern. You're sending your child in and you're having something put into their brain. Any risks that people should consider?
Yes, absolutely. Any procedure we do has risks. But one of the things I mentioned is that when we talk about surgery for epilepsy, brain surgery for epilepsy, it is different than maybe somebody that has brain surgery for an aneurysm or a malignant brain tumor. Our goal in doing surgery for epilepsy is to improve the person's quality of life. So we're only going to do it if the benefits greatly, outweigh any risks. And that's part of the testing, to really assess what the risks are. So yes, there's small risks of like bleeding or stroke or infection just from the surgery itself. And those are things that we really discuss very thoroughly in that road leading up to having the procedure.
How has DBS evolved over time? You mentioned that it originally had covered folks who have Parkinson's. Has the technology changed and altered, or just what we're able to treat with it?
I think both. The study that led up to the FDA approval for epilepsy was a long study. I think it was about 14 years long before the FDA approval actually occurred. KU was one of the sites within the United States that participated in that study. Since it was FDA approved, I believe in November of 2018, like with anything, as you start using it, you learn more about it, and so you kind of get better at using it. But also they have come out with a new model that has some kind of newer features, some of which we're still actually kind of trying to understand to see what information it will give us.
If we could also show the photos of the device outside of the body, because Rachel has a question. She wants to know, how do you adjust the settings, and what are the key signs that something might need to be tweaked? And is that something Donna and Sarah might let you know, or is that something you can see from afar?
So in the office, I have my little kind of computer that can connect to the device. And again, the battery, that's sort of the brains of the device, is the battery. And that's how I can change the settings through that computer. How do we know if something needs to be tweaked? Well, initially, I kind of have an idea of how high the stimulation should go, but the signs that tell us if it's too high or too low are, number one, is the person still having seizures? Then we know we have room to go up. But do they experience any side effects? And then we know we may have to kind of lower some of the settings. Side effects, can be something like a mood change, maybe feeling more depressed. And that's something that then if we lower the settings would go away.
Last questions from Maria. She says it reminds me of a cardiac pacemaker. Is that is that something you could is that comparable in concept? Yeah,
I think because it's a device and actually where it's placed, is similar. But the function itself is different. But I have had many patients actually make that comment because I do think there are some concepts that are similar.
All right, I want to get to our final thoughts today. And Sarah, I want to start with you because I just so much appreciate you sharing your story with us. We can't educate the public without patients that are willing to come forward and share and be open. So thank you for that. What are your final thoughts, or what do you want other people to know that might be facing the same challenges that you are for now?
Well, as a patient, I want them to know that they aren't alone. That there are many people with epilepsy, and also there are support groups. There are lots of websites that you could go to that you could become a part of. I'm a part of an organization for people with disabilities in Missouri. That has been an important part of my life, of course, other than my mom and my family and sisters, my sisters and my friends. That's a big part, to know people that have kind of similar situations, sort of.
To know that you're not alone. And I know, Sarah, you also mentioned you're just really thankful. You say you think of all the things you can do, not the things that you can't do. And I think that is something we should all live by. Donna, you have done an amazing job raising a beautiful young woman. And just what are your final thoughts for us today?
I wish we were on a different journey, but this is what we have, and we try to make the best of it. And every day's a different day. Every day's a new day. It could be a better day. It could be a more difficult day, but every day's new and it has possibilities. And we just get up and we go, and be glad for what we have that works.
Pleasure to meet both of you. Thank you so much. Dr. Ulloa, your final thoughts today.
Thank you, Sarah and Donna. You really touched my heart, and I wish I would have seen that video earlier because I had to prepare. But I think ultimately it's similar to what you're saying. Don't ever give up. Don't ever give up, because I meet people so often that have been going through this for decades and just didn't know that there were other options out there. So I think be an advocate for yourself. If your doctor is not talking about these other treatments, that you haven't heard about, then you can call us. You can ask for a referral. You don't need a referral. You can just call us and make an appointment. There's always new things coming out, so don't give up.
Dr. Hawkinson, another great story today. Great patients. Final thoughts?
I was just going to piggyback on the last thought. It's, again, advocate for yourself. Seek that second opinion. Certainly we've talked a lot about the Comprehensive Cancer Center, but also the other comprehensive centers, Comprehensive Epilepsy Center, but also all of the teams that we have here to collaborate with each other to get those new ideas and really look forward to getting your quality of life better, or your loved one's quality of life better, as we've seen right here. So that's
right.
The message. Yeah.
Advancements, treatments changing every single day. Thank you so much for joining us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. We will see you tomorrow for another edition of Open Mics, because long COVID is a public health issue in desperate need of answers. Coming up on the next Show Me the Science, research is rapidly emerging. Scientific and medical communities around the world are getting a better understanding. The Assistant Surgeon General joins Dr. Hawkinson with insight you will want to hear. We'll see you tomorrow at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.